There are so many different things that can lead to back pain, as we've been learning over the weeks here with Board Certified Neurosurgeon Dr. Jagannathan. And today we're talking about a simple way to take care of many problems with the back. We're talking about spine injections. So take us through what kind of things this can help.
Sure. So spine injections are usually steroid injections that are done around the nerves or along the joints of the spine. And really any kind of painful condition involving spine arthritis, related to disc degeneration or disc bulging, sciatica, stenosis or narrowing within the spine, or arthritis or facet disease, which are diseases to the joints of the spine, can be helped with injections.
Okay. And so tell us what the procedure is like, how long it takes, and how soon a patient will feel relief.
Sure. So the advantage of steroid injections is that they're fairly quick outpatient procedures. Usually the procedure itself can take anywhere between about 5 to about 15 minutes to do. It's almost always done as an outpatient basis. So patients would come in. Some patients who are scared of needles or are uncomfortable can have sedation, where they're put to sleep briefly so they don't remember the needles going in. And usually what we do is we use x-ray guidance to find the area that's affected, and with that x-ray guidance we insert the needle and inject some contrast oftentimes to ensure that it's in the right spot. And then you inject the medications in, and the medication is usually a steroid medication, which is meant to reduce inflammation, along with a local anesthetic that's meant for immediate pain relief.
Okay. How long does this last typically?
There's a high degree of variability in terms of how long it lasts. We have patients who can get it once or twice and oftentimes can manage their problem non-operatively after that. Other patients need more regular follow-up. Commonly, most patients or most insurances would cover it usually between about 2 and 4 times a year. So it's usually within that range. And when you start going beyond that, then it's maybe an indication that it might need more serious evaluation for surgery or for other therapies as well.
Sure. And how long-term can this go on? So you're getting these shots maybe 2 or 4 times a year. For how many years can you do this before you might have to do something more serious?
So the red flags with respect to failure or it not working, one is obviously if the pain doesn't improve. So if you have it and you find the pain is persistent. The other is the presence of neurologic deficits. If you start getting weakness or bowel or bladder symptoms, or worsening pain to the point where it becomes difficult to move, that's a red flag that maybe this is not the optimal treatment. The third is the length of time and the dose of steroids. As we know, steroids long-term can have cumulative side effects. So if someone is having it extremely frequently, in the order of needing it every few months or so, that it might be an indication that it's not the best long-term solution. But that being said, there are older patients or patients who aren't candidates for surgery for whom this is the only option, and it can give them good relief without having to have surgery.
Absolutely. And I think that's what people are looking for. All right, thank you so much, Dr. J. And if you want more information about these steroid injections, you can head to our website, go to 9and10news.com.